Now, let's get a closer look.
The cervix is the lower cylindrical part of the uterus that opens into the vagina. Histologically, the cervix is different from the rest of the uterus and also has a mucosa that doesn't shed during menstruation. The cervical mucosa can be separated into three distinct regions: the endocervix, transformation zone, and ectocervix, which is also called the exocervix. The endocervical mucosa forms the wall of the cervical canal and will have a mucus-secreting simple columnar epithelium. The ectocervical mucosa is present in the part of the cervix that protrudes into the upper vagina and surrounds the external os, which is the lower opening of the uterus. This mucosa will have a non-keratinized stratified squamous epithelium that's continuous with the vagina. The transformation zone is the region between the endo and ectocervix. There's an abrupt change from columnar cells to squamous cells within the transformation zone called the squamo-columnar junction. The exact location of the squamo-columnar junction will change or shift depending on the age of the individual as well as changes in the size of the uterus during menstruation. The transformation zone is also the ideal site to collect cells from during a pap smear or pap test. Underneath all regions of the cervical mucosa is a thick cervical wall that consists of dense connective tissue. Unlike the uterus, it only has a small amount of smooth muscle present. The vagina connects the cervix to the external opening of the vagina called the vaginal vestibule. The wall of the vagina doesn't contain glands and is composed of three main layers: the inner mucosa, which is typically about 150 to 200 micrometers in adults, a muscular layer called the muscularis, and an adventitia of connective tissue. The adventitia also contains a large amount of elastic fibers, which allow the vaginal wall to be both strong and flexible, which is particularly beneficial during childbirth. Let's first take a closer look at the mucosa of the endocervix, which is continuous with the endometrium of the uterus and is lined with a similar epithelium of mucus-secreting simple columnar cells. Underlying the epithelium is a thick lamina propria, which contains the large, branched cervical glands that produce about 20 to 60 milligrams of cervical mucus per day. But during the time around ovulation, the increasing level of progesterone will cause the glands to produce significantly more cervical mucus, which can be as much as 600 milligrams per day. The consistency of the mucus will change as well and become watery. This allows the sperm to move more easily into the uterus. At the transformation zone, the simple columnar cells of the endocervical mucosa suddenly change to the stratified squamous cells of the ectocervical mucosa. Pap smears ideally include the transformation zone because cells in this zone are frequently undergoing metaplasia, changing from columnar cells to squamous cells. The frequent changing of cell type increases the chance of an abnormal change to occur, which can potentially be a precancerous change. Squamous cell carcinoma is the most common type of cervical cancer and is most often found in the transformation zone. Human papillomavirus, or HPV, is also a predisposing factor for squamous cell carcinoma, particularly the strains HPV-16 and HPV-18. The mucosa of the ectocervix is lined with the same non-keratinized stratified squamous epithelium that was seen in the transformation zone. The middle and surface layers of the vaginal epithelium store glycogen, which is released when the epithelial cells are shed or exfoliated. The normal bacteria found within the vagina will metabolize the glycogen and produce lactic acid, lowering the pH significantly, which helps inhibit the growth of many pathogenic microorganisms such as Gardnerella vaginalis and Trichomonas vaginalis. Cervical glands can be found in the lamina propria of the mucosa, but there are very few of these glands when compared to the endocervix. Alright, now let's move to the wall of the vagina. The vaginal wall is lined by the same type of stratified squamous epithelium that's seen in the ectocervix. Also similar to the ectocervix, the middle and surface layers of the epithelium store glycogen, which indirectly leads to a lower vaginal pH that helps inhibit the growth of pathogenic microorganisms. Underlying the vagina's mucosa is the supporting layer of dense, irregular connective tissue called the lamina propria. This layer is highly cellular and rich in both elastic fibers as well as collagen. The lamina propria also forms narrow projections, or papillae, that extend into the overlying epithelium. Also, unlike the cervix, there are no glands found within the lamina propria of the vagina. The next main layer of the vaginal wall is the muscularis, which consists of two layers of smooth muscle that are not clearly differentiated or defined. The inner layer is arranged circularly around the vaginal canal, and the thicker outer layer is arranged longitudinally. Just outside of the muscularis is the outermost layer of dense and loose connective tissue called the adventitia, but this layer is often not included in histologic images of the vaginal wall.